welcome back to me and my pink chair. My name's Surina, I'm a junior doctor working in the UK, and recently I've made the somewhat serious decision that I want to be a surgeon. In the UK, after graduating university, you enter general training called foundation training, where you spend a few months in different rotations. Everyone does a different mixture, and at the end of those 2 years, you can enter the specialty training program that you want to. Although a lot of people take a break at that point for about a year, and it's probably something I'll do too. It's quite common here to be a doctor early in training and not really have any clue about what speciality you want to go into. And as someone who has problems making even the simplest of decisions, be it what I want to eat that day or what kind of hello I want to greet someone with, it's been quite a shock to me that I've been able to make this pretty life-changing decision and be quite sure about it as well. So how did I come to this decision? Well, long story short, it actually started at the end of medical school, where I sort of fell into doing a surgical elective in Fiji in 2019. For full details, check out this video where I summarise my whole experience. However, I still had my reservations, given all the bad press that surgical training gets for being so long and grueling and not very life-friendly. So I needed to find out more. Since then, I've had quite a lot of surgical experiences, met lots of surgeons, and even sat a surgical exam to try and suss out whether this intrigue was actually legit enough. I think I've arrived at a pretty solid conclusion that this is what I want with my career, and I've found ways that it really suits my personality in ways that I didn't immediately see before, so I thought I'd share those with you today. From a selfish point of view, I thought it'd be good to look back on this and look at how enthusiastic and excited I was, because if there's anything about working as a doctor I've learned is that enthusiasm wanes very quickly. Also, if other people are having trouble trying to work out what career path they want to go to, maybe you'll hear something today that you hadn't thought about, and you might see parts of your personality in the things I'm about to say today. I've always loved making things for as long as I can remember, be it birthday cards or cake or even pieces of furniture. There's just something so much more intrinsically enjoyable about eating something or using something that you made with your own hands. And within medicine as well, I found that a lot of doctors agree that their favourite part of the job is the procedural parts, where you're sort of carrying out practical clinical skills. It got me thinking that if that's the part of the job that I find the most satisfying, then why not build a whole career around it? There are many procedures involved in lots of other specialities as well, but with surgery, the procedures make up the very foundation of the job, be it sort of simple drainages of abscesses and cysts, all the way to emergency open abdominal procedures. And mastering these procedures basically becomes your art, so you can do them more smoothly, more accurately. When I first started as a doctor, I was really nervous about practical skills, even like taking bloods or putting lines in patients to give them medicine, because I shied away from them in medical school. I was really nervous about them, and there was always a safety net that there'll be a junior doctor who can do it if you can't. But once I started as a doctor, I realised that there was no safety net, and often we're doing these procedures in the middle of the night when there's literally no one to be called, and they're very, very urgent to do because the patient's really unwell. So there was basically no option but to get good at them. I made it one of my main goals to get really good at them. I did every blood test I could, every cannula that I could get my hands on, and I think that obsessive side of me is going to get a lot of satisfaction from a career in surgery, because you're constantly learning through repetition and doing the same procedures again and again, and doing more and more complex procedures as you get more experienced. Yeah, that's something I'm really looking forward to. Leading on from that point, with surgery, you can really enjoy the fruits of your labour. I'm not sure if I used that correctly, but what I'm trying to say is that surgery seems to be a really rewarding career, where you can see improved patient outcomes pretty much almost instantly, be that offering life-saving treatment where you are removing a burst appendix that could get infected, or life-extending treatment where you're cutting out a cancer. These improved outcomes, they are so tangible and so visible, and I am all about those instant rewards. I know you can obviously make these huge differences in so many other specialities as well, but in my otherwise very overthinking and very cluttered mind, there's something really beautiful about the simplistic philosophy of surgery of, is it a problem? Cut it out. And that is very, very simplistic. Obviously there's so much more to it than that, but it's just the general vibe that I really like about surgery. I don't know when or how this happened, but I noticed at some point the panic of doing something wrong in theatre, like touching something you shouldn't or having the scrub nurse shout at you, slowly started to fade away, and I was following the theatre etiquette without even thinking about it. And what's more is that I love that there's a theatre etiquette. There's a certain way to stand, certain order you have to do things in, checklists that you have to go through, and it's just so well thought out and so measured, and I absolutely love it. I think this comes from me feeling happiest when I'm in a situation where I feel in control, and because everything feels so well controlled in theatre, I think it makes me feel quite calm. Another thing I love about being in theatre is seeing the teamwork that's displayed there. Everyone has a very specific role, and each role is so incredibly important. The surgeon may be performing the operation, but they rely so heavily on the anaesthetist for keeping the patient safe, the theatre assistants for making sure the positioning of the patient is okay, scrub nurses for making sure they've got the right equipment available to ensure everything goes smoothly. And you can really see the difference between a really good consultant who has a good rapport with their team and has created a really nice atmosphere, which is so important for making sure the members of the team feel comfortable so they can speak up, especially if they think there's a mistake being made or something's gone wrong. Such a contrast from watching a consultant who's maybe a bit more curt and even sometimes downright rude, and creates completely the opposite atmosphere, which can be so dangerous. And I really want to be that good consultant who leads really well, creates a really good team dynamic around them. So that's something else I'm looking forward to. Lastly, what I love about theatre, and it's a bit odd, and it's something I've realised quite recently as well, is that I just love how there are functional and specific tools for anything you need to do in theatre. When I'm watching a surgeon operate and they have a really small access point through which they're trying to manoeuvre something or retrieve something, nothing blows my mind more than when they ask for some random surgical object. Don't ask me the names, all the surgical objects have these classic old white man names like Langerhans and DeBakey or something like that. But they ask for something and they get given a tool which helps them do that maneuver completely perfectly. I guess I've always liked having order and purpose in the stuff I use as well. So be that finding the perfect shoe for running versus the perfect shoe for weightlifting, or the perfect app for note-taking, or even like beauty products. I have no clue what I'm doing with makeup or anything, but I still have all the different brushes that you need for specific parts of your face. And I don't know why, but I love it. In surgery, I love the degree of involvement that you can have with your patients, especially as you get more senior. As you get more experienced, you are the one leading the surgery, you're the one doing the operating, so you're counselling the patients pre-op. So you're counselling the patients preoperatively. Oh, I need some water. You can counsel your patients preoperatively, telling them about their options and addressing all their concerns. And then afterwards as well, guiding them through their recovery, following them up, and hopefully seeing them get better and live better quality lives than they did before. So I really love that continuity and long-term relationship you build with your patients, and in return the trust they put into you for literally cutting open their body. That's such a huge privilege, and it's a privilege that I'm pretty excited to earn. Alright, thanks so much for watching. I hope you found that interesting, whether you're considering a career in surgery or you were just interested to know more about what it involves. As always, we'd love to hear your thoughts in the comments below, and I'll see you in the next video. And then God, you're getting really bad split ends. There are bits in that.